Hi, let's talk about stomach ulcer. Do you know that it is not starvation or eating late that causes ulcer? It shock you, Abby? Because that's the general idea. Once you tell someone you're having stomach ulcer, they say, you know the chop? Before you rush me, there's a background knowledge that I want you to have. And that is, you see this tummy that we can touch? This is just the abdomen. Since where you small reach now, you dey hear, show me your stomach. This is my stomach. This is not your stomach. The stomach is an organ inside your abdomen. There are a lot of things inside here, and the stomach is one of them. Stomach is just a particular organ where your food enter when you eat. It is part of the digestive tract. It is the stomach that will break down the food before sending it to your intestines. Your stomach naturally is lined with a protective coat. It is the same lining that you have inside your mouth, like a very thin waterproof lining. This lining is the reason why the hydrochloric acid inside your stomach does not harm you, even though it is a very strong acid that can melt a lot of things. So grab this small knowledge now, because it will help you understand what I'm going to say next better. Primary causes of stomach ulcer: the H. pylori bacteria. You can pick this bacteria by eating contaminated food or drinking contaminated water. You can get it from someone else. Over time, it will cause a wound inside your stomach. This wound will bypass the protective layer and burrow into the organ itself. So, because that place is now unprotected, if that hydrochloric acid now touch that spot, you begin to feel that burning sensation, that pain, nausea, the vomiting and discomfort that you know come with stomach ulcer. You understand, ba? The second thing is excessive use of NSAIDs. A very common example is ibuprofen or diclofenac. As you know, they patronize actual pharmacists. Most of your chemists are very good at selling these medications to you the moment you complain of pain, I have headache. It's even very rare for you to see a chemist that you complain of pain and they'll just give you paracetamol. Some of them will even sell more than one NSAID at once to you, and they will tell you pack all of them, take them 2 or 3 times a day. Some of them may be because they don't actually care, or some of them, they don't know the dangers of what they are doing, or they won't sell markets. And you know the craziest thing? You will not know, because most of these medications, they have different brand names. So if you're looking at the pack, searching for where they wrote diclofenac, where they wrote ibuprofen, you may not see them. If they put another one with a different brand name, but it is the same medication. So when you use these NSAIDs excessively, you could end up getting that wound on the wall of your stomach. Or the category of people that will tell you, 2 tablets of paracetamol, it doesn't work for me. Now 4 are they take, because you know better than the person that prescribed the medication to you, or you know better than the person that manufactured that medication. So you belittle the efficiency of the medication, so you take double of the dosage. At some point, they'll start feeling like even the 4 tablets does not work again, so let me upgrade. So any little pain, they are taking diclofenac, they're taking ibuprofen. Another cause of stomach ulcer is excessive use of alcohol. Boy, mbado one crate o kunga ngoche in 30 minutes. Akora ga aka bada. You don't get any type of tree where I never smoke. Me, we don't smoke in Changu. You don't smoke in Changu before. Ain't much highlight any exhaust pipe. Honorable member of chain smokers. Now only popo liver never smoke. You can smoke anything, you can drink anything. You're on your way to having a stomach ulcer with ishimmaige. Okay, so nurse, what you're trying to say now is that even if I don't eat, I will not have a stomach ulcer. Yes, because your body is built to have reserve, to sustain you even when you are not eating. That is why you can fast. But here is what will happen if you don't eat. When your stomach is empty, there will be an excessive production of that hydrochloric acid. And when the level don't rise, it is going to touch those wounds, aggravate the symptoms. You will feel more discomfort, but eating will not automatically heal the wound, because just like every other injury, it needs time to heal. Why not? Now, another myth about stomach ulcer is that once you don't get them, you don't get them. You no go ever go again. Also, after everything where I don't treat, I don't drink plantain water. It's a lie. Ulcer is treatable. Now, this is what you, the patient, can do. Eat nutritious food. Eat on time, so that you don't end up with avoidable discomfort. Avoid spicy meals. Most ulcer patients get coconut head. You will tell them, don't eat spicy meals. Now, there, you go see them. Like say they bury their placenta with pepper. Imagine when you have a wound you can see and you're pouring pepper on it. Leave carbonated drinks alone. Any drink that when you open it, it will do shh. Run. Oily foods, fry, run. And of course, the elephant in the room. Leave NSAIDs alone. Normalize taking basic pain relievers. I know say una don't see paracetamol finish. Even in the hospital, when you give a patient paracetamol, they go just rate them, or that paracetamol hospital. It's just paracetamol. Do you know that paracetamol can shut down your liver? Most times, the headaches you feel, you just need to rest. You've been on your phone and laptops for long. You just need sleep. Sometimes you are just hungry. If you eat, the headache will stop. Sometimes you are so dehydrated. Drink water. So which medication can I buy? This is social media. It is not a hospital. How do I now treat the stomach ulcer? It is done in a place called a hospital. Go there. There are medications for it. They will treat the root cause. With time, the ulcer will heal. You'll be fine. So, our night class is over. School dismiss. Away. Bye-bye.